Welcome to Nursing Recipe. My name is Courage Isinkak, and today we'll be going through the basic concept of mental health and the role of a mental health nurse. So let's jump right into it. The definition of mental health. It's very important to know that there are several views associated with the definition of mental health, but for simplicity, we would define mental health as a state or a condition in which an individual feels a sense of well-being. What are the factors that affect mental health? We have predisposing factor, we have precipitating factor, we have reinforcing factor, we have psychological factor, we have social cultural factor, hereditary factors. So let's explain them. Predisposing factor is a condition that comes before and pave the way for later words maladjustment from the word predisposing, before. An example is a child which is much rejected in his um, childhood has a tendency to do or to develop mental disorder. Then we have precipitating factor. Precipitating is a condition that proves too much to bear for an individual and triggers maladaptive behavior. An example is the sudden death of a loved one can cause a what? Mental disorder. Reinforcing factor is a condition that tends to maintain the maladaptive behavior already present, such as what? Sick row and relief from unwanted responsibility, say for the family. Psychological factors, you have mental deprivement, you have deprivement in homes, defective family pattern structures, you have early psych trauma and severe stress. The next factor we're going to talk about is the hereditary, genetic defect, chromosomal defect, faulty genes. Then you have constitutional liability, where what we'll talk about the physically handicapped. And then we have malnutrition can also lead to or can also be a factor affecting the mental well-being of a person. You have sleep disturbance, you have emotional disruption, you have brain pathology, and also the social cultural factors. The cultural and the societal um, um, contribution to a person's well-being can affect. And you have war and violence, you have economic and employment problem. This last one is almost what we face here in Nigeria. I mean, the employment problem and economic problem can cause or can affect a person's well-being. Now, how do you maintain a good health or a good mental health? You have to have self-esteem. This is not all the list, this is just a few of them. There are much more, of course. You have to have the ability to love, have the ability of, you have to have a feeling of belonging, you have to accept your responsibility, and you have to like and trust other people. Now, it's very important to know that mental health may differ from countries to countries. The 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 acceptable the acceptable um, behavior in a country differs from the acceptable behavior in another country. So that's why we say that the mental health may differ from country to country. That's very important to notice. And then also are the signs and what are the signs of poor mental health? This is not all of them. This is a few of them. We have poor adjustment to stress. We have violent behavior. We have precipitating nightmare, that is continuous nightmare. We have undue shyness. These are signs that someone has a poor mental health. And then we have confused thinking, we have delusion, we have thought of suicide, denial of obvious problems, afraid without real cause, just afraid. There's no real cause of why you have been afraid. These are signs of poor mental health. That's that for mental. Now we're going to be talking about mental health and psychiatric nursing. First of all, this is a branch of nurse in which part of nursing in which a nurse utilizes her own personality, her knowledge of psychiatric theory, and the available environment to affect therapeutic change in her patient's thoughts, feelings, and behavior. Mental health and psychiatric nursing is a branch of nursing whereby the nurse utilizes her personality, her knowledge of psychiatric theories, and the um, available environment to affect the therapeutic change of a patient's thought, feelings, and what behavior. A mental health nurse must possess a strong knowledge base and the skill for good nursing practice. So the practice, it's also a practice of promoting mental health as well as caring for people who have mental illnesses, potentiating their independence and restoring their dignity. That's what a mental health and psychiatric nurse is all about. Now, what are the functions of a mental health nurse? First of all, you assess the client and then you plan nursing care. That's like the main thing for all our nursing procedures. And then also you provide a safe nursing care, including medication, therapy, and interaction. Then you provide a safe environment, including protecting the client and others from what? From injuries. You also observe and document the client's behavior. You also provide feedback for the client based on the observation of his or her behavior. You teach the client and significant others. Significant others can be relatives, can be the community. Yeah. And then you also involve the client and the client's significant others in the nursing process. It's very important. And then you provide opportunity for the client to make his own decision and assume the responsibility of his emotions and life. You also cooperate with other professionals in various aspects of the client care, thereby facilitating an independent disciplinary approach to the care. Continuous nursing education, and then explore new ideas, theories, and research. We've come to the end of this tutorial, and then please do well to like, subscribe, and comment below. Thank you. See you next.